I'm Dr. Michael Medvecky from Yale Orthopedic Surgery. With us also is Paul Bauer, owner of Physical Therapy Associates here in Guilford.
The goal of Guilford Basketball League in adopting this video is to provide a tool for the coaches to use in order to help learn a proper warm-up program to help prevent ACL injuries in youth athletes. Our goal is that the video will provide for widespread progressive implementation of this program throughout youth sports to help prevent knee injuries in young athletes. Thank you. We hope the video is useful.
This introductory presentation has three main goals. Number one, to increase the awareness that there is a difference in the rate of anterior cruciate ligament or ACL injury between females and males. Number two, to describe what an ACL injury is and to understand what else can be injured during that injury. And number three, to increase parental awareness of the availability of injury prevention programs that can be easily incorporated and have been studied in large groups of athletes. Female athletes who participate in pivoting and jumping sports suffer from ACL injuries at approximately a 4 to 6 times greater rate than males. Approximately 50,000 ACL injuries occur in female athletes in the United States each year. The total healthcare cost associated with the treatment of this injury is staggering, as seen on the slide. Many studies have demonstrated a much higher ACL injury rate in women versus men in both high school and collegiate athletes. A few of these studies are listed here. Anatomically, the motion of the femur on the tibia is controlled by 4 main ligaments, 1 on each side and 2 in the center. The ACL is seen in the picture on the right within the central aspect of the knee connecting the tibia to the femur. The white surface seen on the picture on the right represents the articular cartilage. The articular cartilage does not regenerate, and damage or wear and tear of this surface results in arthritis. There are 2 semicircular rubbery structures within the knee called the meniscus, which act as shock absorbers and distribute force on the hard articular cartilage. The majority of ACL injuries in women occur without any direct collision with another player. They occur from planting and changing directions, pivoting, or landing from a jump. There has been shown to be a fairly predictable body position that occurs when the ACL tears happen. The knee tends to buckle inward towards the center. The knee is relatively straight in the front to back position. Most of the weight tends to be distributed onto the injured leg, and the upper body is usually tilted off-center, resulting in an imbalanced landing. In about 50% of ACL injuries, a meniscus tear occurs. Meniscus tears can occur in different patterns, some of which are repairable, meaning sewing it back together with a good chance of healing success. Some other tear patterns are not fixable, and the meniscus tissue needs to be removed. Loss of the meniscus results in increased pressure on the hard articular cartilage and increases the risk of longer-term arthritis. An ACL injury typically results in loss of an entire season of athletic competition, as surgery and the recovery associated with it takes approximately 8 to 12 months to be able to return to sport safely. The injury has also been shown to result in decreased academic performance, likely secondary to the additional social and mental health stresses due to the altered activity and lifestyle. Even with a stable knee after surgery, there's a much higher risk of osteoarthritis than that compared to the uninjured knee. Not all athletes are able to return back to the same level of competition from that before their injury. It has also recently been shown that within the first 2 years after ACL surgery, there's an approximately 30% chance of re-injury, with a 20% chance of an ACL injury to the opposite normal knee. ACL reconstruction is considered the standard of care for an ACL tear in an athletically active individual. Return to athletics with an unstable knee puts the athlete at risk of re-injury, with subsequent damage to the meniscus or the hard articular cartilage, with further buckling or giving way episodes. There are many factors that go into why females are at higher risk of ACL injury. The factor that carries the most support is a gender difference that occurs after puberty, resulting in changes of the neuromuscular control of the lower legs and trunk. The images of a male and female Yale varsity athlete landing from a box jump demonstrate the typical knock-knee position that women more commonly than men demonstrate during athletic activity. In spite of her muscular strength, her muscular control is not sufficiently keeping her knee from collapsing into the risky position that places stress on her ACL. A recent analysis of the highest quality studies published in the world's medical literature on various ACL injury prevention programs has demonstrated significant injury risk reduction in both women and men. Although no one program is considered the best, they all have components of hip, core, and hamstring strengthening, balance, landing, and pivoting exercises. Two programs that allow for independent application of exercises and don't need specialized training to incorporate are listed. We feel the PEP program allows for the most ease of application to a widespread group of coaches and participants, and is the program that will be demonstrated in the following section. We'd like to commend Guilford Basketball and their board of directors for their foresight in accepting the task of encouraging widespread implementation of an ACL injury prevention program. They are unique in this effort, and it requires the commitment of its coaches to learn the program and lead its consistent use. We thank you for taking the time to learn about this background information and our rationale for implementation, and hope you enjoy the remainder of the video.
Coaches should spend a few minutes before the PEP program explaining to the athletes that the purpose of this program is to prevent injuries by improving the control and stability of the legs during sport. Reinforce that the exercises should be done slowly, correctly, and with focus on form rather than on speed. Focus on quality of movement, not quantity of movement. The warm-up begins with a slow and deliberate jog from sideline to sideline. Athletes should be encouraged to use good posture, work on soft landing, and focus on keeping the foot, knee, and hip in alignment as they land each step. The shuttle run should be completed from an athletic stance with wide base of support, hips pushed back, and hands pushed forward. Avoid the feet coming together, losing squat depth, or the inward collapsing of the knees. The warm-up ends with a backward run, which should again be slow, deliberate, and controlled. Athletes should land on the toes with a slight bend in the knee and with a soft, quiet landing. Strengthening begins with the walking lunge. Athletes should land heel to toe, squat through the front leg, and keep the knee aligned with the foot. Care should be taken to avoid the knee collapsing inward during the lunging motion or when arising up out of the lunge position. The Russian hamstring. With athletes paired up as shown, the first player tips forward as far as possible while maintaining a straight back. She then returns to the starting position, being careful to avoid bending at the hips at any point during the exercise. The final strengthening exercise is performed by balancing on one leg and slowly rising up onto the ball of the foot through a full range of motion and then slowly lowering back down. Remember the underlying concepts of balance, control, and stability. Avoid rushing through the movement, limiting the range of motion, or losing balance. Plyometrics begin with lateral hops, where on the sound of the whistle, players jump sideways over the sideline and land immediately into the athletic stance from which they started. Cue the athletes to assume a hips out, hands out position before they jump and immediately upon landing. Also encourage a soft, quiet landing on the balls of the feet, as well as strict avoidance of the knees collapsing inward. During the forward-backward hop, players again assume the athletic stance with the hands out, hips out position. This time, they hop forward and backward over the line with the same coaching cues as in the lateral hop. That is, avoid the knees collapsing inward on takeoff or upon landing, land soft and quiet, and assume the hands out, hips out position immediately upon landing. Plyometrics continue with single leg hops using the same coaching cues as with the double leg hops. This time we add a balance component to the athletic stance, the controlled takeoff, the soft landing, and the hips out, hands out position. We continue to actively coach the control of motion on takeoff and landing, always being conscious to avoid the knee collapsing inward. The single leg forward-backward hop uses the same coaching cues as the prior hops: controlled takeoff, soft landing, hands out, hips out positioning, and avoidance of the knee collapsing inward at any point. As the athletes improve, encourage them to stick the landing and avoid the second mini hop or shuffling of the foot sometimes needed to keep their balance. The scissors jump should be completed on the sound of a whistle, with the players holding the lunge position until the next blow of the whistle. The plyometrics conclude with a vertical jump exercise where, on the coach's cue, the players jump straight up, lengthen the torso, and then land softly and quietly in the athletic stance starting position. We again encourage athletes to avoid an inward collapsing of the knees on takeoff or upon landing. Agility drills begin with a 3-step deceleration, during which we encourage proper slowdown and speed up mechanics. Players begin by jogging across the court when, on the sound of the whistle, they slow down, then stop using a deliberate 1, 2, 3 count to their steps. Having the players count the steps out loud when performing this drill can help keep the players in sync and in proper form. The bounding run is a jog with high knees where we encourage the athletes to hop from foot to foot in the high knee position, propelling themselves forward and upward more than they would during a regular high knee jog. We continue to coach a soft landing, athletic stance, and control of motion above speed or distance. Be sure to avoid skipping, as you can see in a few players here, when completing the bounding run. The lateral diagonal run is completed through a zigzag of cones set up ahead of time by the coaching staff. Athletes form a line and feed through the cones one at a time, practicing proper change of direction mechanics. Players should run straight ahead in a diagonal direction toward the first cone. When they reach the cone, they should plant the outside foot, control their momentum, and push off toward the next diagonally placed cone. Upon reaching the next cone, the athlete again plants the outside foot, controls the momentum using proper flexed hip and flexed knee position and good stability, and then pushes off toward the next cone in the series. This drill is essential to teach proper change of direction mechanics, a condition where we often see knee injuries arise. The proper landing techniques discussed earlier should be reinforced one last time during this drill. There are 5 stretches to be completed as part of the PEP program. The calf stretch is done with the hands on the ground, one foot crossed over the other, and the stretching leg flat on the floor if possible. Switch legs partway through. Quad stretching is done in standing, with one leg bent up behind. The hand on the side of the stretched leg reaches back and pulls the foot up towards the buttocks. Switch legs partway through. The figure 4 stretch is designed to stretch the hamstring. The player should sit on the floor with one foot out and the other bent in. The shoulders should be squared up to the outstretched leg, the back kept straight, and the body lowered toward the leg being stretched. Switch legs partway through. The inner thigh is stretched with the players seated on the ground and legs spread apart. Keeping the back straight, the torso is lowered toward the floor, between the outstretched legs. Then, the athlete can reach the arms toward the right foot, square up the shoulders to the right leg, and again, lower the torso with a straight back. Stretching the hip flexor is accomplished with the players in a half-kneeling position. Players shift the body forward, keeping the body weight on the back leg, and lean into the front of the hip as best they can. Switch legs partway through.